As a physician, I guess what really brings people into my office from a mental health perspective is that they've really either hit a wall that has been obvious and they couldn't get around it in any other way, or they have run out of resources and are typically looking for a way to really fix a problem that they have not tried, but either don't have money, don't have insurance. But it's really basically their life coming to an absolute standstill from a perspective of being able to function on an everyday basis. And when I meet with them and you translate that back, you've seen that over time they've just ignored things, either sleep issues, mood issues, eating issues, or whatever. But it's basically their life coming to a crash on some level. So the more that the media can do to let people know that there are red flags you can see way ahead of time that will then translate into huge problems if we don't address them, the better off we'll be. Something as simple as a sleep issue can be a red flag or can lead to something. Something as simple as not doing well in school for a 5-year-old. Those simple little things that are not going to scare people to watch can really help and identify issues early on. Looking at ambient traumas and different things that you wouldn't think weigh on someone's brain that over time prevent the growth of someone's brain neurologically to connect in the wirings to work the way they're supposed to work so that your thoughts and your feelings are appropriate. So the more trauma that you have, the slower the growth, the more inability it is to be able to function. Then on top of that, added external trauma, you then have the genetics of what are going to happen to you anyway, no matter what. So that combo can then lead to someone who is a serial killer or who is enraged and not able to handle the anger from that trauma that they've heard. And there's a lot of presentations, lots of research out there that we learn, and I do one for our department where I teach our social workers who are knocking on these 18,000 doors a month, that it's important to understand that if we just take that child out of that home that night, even if they go back within the next week, which very rarely happens, the showing of what happens neurologically and how we stop their brain growth just from that one traumatic event and how that could translate into them as an adult has been very impactful. Something just as sitting in your neighborhood hearing a siren is very traumatic over and over again, much less a gunshot, much less the police barging in. So you're absolutely right. Those things do translate to something.